So now you're getting a double hit. One is from your diabetes, one is from your chronic kidney disease as well.
Yeah.
And when you get COVID-19 disease, be it a pneumonia, be it any other disease like gastroenteritis, the disease tends to be more severe in chronic kidney disease patients. Remember that some of our patients have also undergone a kidney transplant.
Right.
So they are on very heavy immunosuppressive drugs to prevent the body from rejecting that kidney. So we really have to suppress the immunity as well. So now imagine somebody getting a viral infection like COVID-19, which is highly contagious. So their chances of developing very severe disease and their chances of having a high mortality, meaning dying from the disease, is quite high.
It's quite high.
Yes.
All right, let's see if we can get Dr. Gabala on. I hope he can hear me. Dr. Gabala, if you can hear me. Good morning. Thanks for being with us.
Good morning.
Good morning. All right, we're trying. Thank you. We are trying to understand how certain conditions or diseases actually put us at a higher risk, or at least getting a more severe issue when it comes to COVID-19. Please tell us, in regards to cardiovascular diseases, how that really does put us at a higher risk.
Okay. Well, thank you for the question. Patients with cardiovascular disease are at higher risk for both COVID infection and more severe form of the disease. Those with high blood pressure or hypertension, those with coronary heart disease, myocardial infarction, heart failure, and so on.
Okay.
So those patients.
Dr. Gabala, sorry, we understand that the connection isn't as clear. Allow us to just work on that particular link, but I'll get back to you on that. But it really does look like, Dr. Saira, that we really do not understand the risks of diabetes. Do you feel that there's still people underestimating what this disease could do?
Yeah, so like what we have seen with our patients is, of course, we know like in the world, currently, if you look at the adult population, if you look at the people between 20 to 79 years of age, about 463 million of them are, they have diabetes. That's according to the IDF, International Diabetes Federation Atlas, the current one. And these are figures from 2019. And these are expected to definitely go higher, like up to almost 700 million by the year 2045. So you can see that there's a very vast population that has got diabetes, and most of this in that adult age group is type 2 diabetes. Whereas about almost 1.1 million children, like younger than 20 years, do have also type 1 diabetes. Now, the thing is, knowing the link, like the fact that diabetes can actually lead to more severe disease, that is so crucial. So if you look at basically, first of all, knowing whether you have diabetes or not, where you are looking at the risk now to know that you'll get more severe disease. Maybe now is the time more than ever to like emphasize on our screening strategies to detect diabetes and to pick it early and probably to handle it early on and to look at the risk factors. So when we look at diabetes, it's actually quite broad. It's not like it's diabetes and that's it, you see. So there's like 4 different categories of diabetes as we look at it. So there's type 1 diabetes, which is constitutes about 5 to 8% of all the people with diabetes. Then there's type 2 diabetes, which constitutes the majority of people living with diabetes. Then there's the gestational diabetes, which is the pregnancy-related diabetes, which also the risk with COVID is probably quite high, although the what definitely we know is that type 2 diabetes patients have the highest risk to go towards severe disease with COVID-19. Then you've got the other specific types, which could include, diseases of the pancreas from where your insulin comes out, or certain hormonal problems, certain medications. There are other genetic forms of diabetes. So diabetes is basically quite broad.
It is.
What we discuss when you're looking at screening for diabetes and risk factors for diabetes is mainly type 2 diabetes, which is heavily linked to lifestyle risk factors. So where we are looking at either the modifiable and the non-modifiable risk factors. So not modifiable means you cannot do anything about it. For example, like increasing age. As you age, the risk of developing diabetes is higher. You cannot reverse your age, so that's like a not modifiable. Okay, certain ethnic groups are at higher risk of diabetes. You can't change that. Whereas if you look at now the modifiable risk factors, which is what we are looking at, and I believe like this is an opportunity for everyone out there to like actually look at those risk factors and try to reduce them as much as possible, including those who have type 2 diabetes.
All right.
So these are like overweight and obesity, having a body mass index which is higher. Like having a weight which is higher than that recommended for your height.
Okay.
That's the BMI. Okay. Things like poor diet, basically diets high in carbohydrates. High caloric intake diets. So those are the things that we need to look at healthy eating at the moment. Okay. Poor physical activity or lack of physical activity, that has definitely been linked to a high risk of diabetes. Sedentary lifestyle, sitting at home or sitting at work, you know, going the whole day doing a desk job, going at home, again sitting in front of the television, and then, you know, just taking off without any physical activity. Having that also predisposes at a risk.
Okay, so we'll highlight a little bit of those, you know, towards the end of the program, because I like the points that you're actually bringing up as a reminder before we even say Kwaheri. But Dr. Hussein, getting back to even what your patients typically have to go through, especially now during this period of COVID-19, you see a lot of people shying away from health facilities because of, you know, risking the idea of contracting the disease. How have patients ideally been dealing with typically COVID-19 at the same time having to go in for their treatments?
So basically the patients who have chronic kidney disease are a special subset of patients because of the fact that we deal with dialysis, which is life-saving. And all the patients who have got end-stage kidney disease or stage 5 kidney disease basically are on hemodialysis as a modality of treatment, with a minimum number of sessions to be twice a week. So twice a week, those patients have to come to the hospital. They have to be put on the machine for dialysis for a minimum of 4 hours. So technically they spend 6 hours twice a week in the hospitals. So when the COVID-19 started, we at the MP Shah Hospital had realized that based on what was happening in the West, people were actually shying away from coming to the hospital. Now when a patient who is on dialysis misses his dialysis treatment, it can be quite detrimental, and the patients actually become quite sick because the toxins accumulate in the body, the excess fluid accumulates in the body, the patients get problems with breathing as well, they become very tired and fatigued, and some of the electrolytes like potassium become very high, and that can be quite dangerous. So we had to talk to them, we called them up, we put measures in place immediately from the word go. Our CEO, Dr. Tosif actually set up a committee, and we basically set up a screening program for all of our patients, including our dialysis patients. So they were screened from the time they entered the hospital to make sure that they had no fevers, there was no cough. You know, there's a screening questionnaire that we have. And if any patient was found to have any of those symptoms that would suggest, then they were actually sent to see the doctor first in the accident and emergency department, and they were screened. Then we also told our patients who are on dialysis and who are transplant patients that in case if they have developed any fever, they should let us know immediately so that we can ask them to come to hospital and organize for them to be reviewed by the doctors. And if our plan was that if we find any patient who is on dialysis to be having COVID-19, we have measures in place to dialyze them, but at the same time not compromising the safety of the staff and of the other patients as well.
All right. Remember, we do have our question of the day, even as we continue to engage the experts in studio. And we have that for you on your screen. We're asking about what misconceptions about COVID-19 do you feel that Kenyans still believe to be true? What misconceptions do you think about COVID-19 do Kenyans still believe to be true? Talk to us. What are some of the recommendations that you would also suggest? Do you also support what's happening across the globe? Look at what's even happening in England, staring at a possible lockdown come this Thursday. Do you think this is what it takes for us to at least flatten the curve? Talk to us a little bit. I understand Dr. Gabala is back, Bona Director. Okay. All right. Dr. Kabala, sorry, apologies about what had happened earlier on. These are the ups and downs of live television. But yes, go ahead and explain to us about the link of cardiovascular disease and, you know, the impact that it has on you having COVID-19.
Hi. Can you hear me?
Yes, I can hear you.
Okay. So the vascular disease risk for COVID infection, and even when they get the infection, they have more severe disease compared to other people. And of course, because of heart disease patients, they are a little bit at higher age, like after the age of 50 or 60, when they have more complication of atherosclerosis, hypertension, and diabetes. So the cardiac patient, they tend to be more aggressive when they develop the disease, and ultimately can lead to complete destruction of the lungs and more flourishment of the disease. Mm-hmm. So that's why we always give them advice not to mingle with crowd in any gathering. Try to take like more exercise, less stress, and eat better with more vitamins and so on. So that's the advice for most of the cardiac disease. The more important point here that cardiac patients, we lost a few patients because they were afraid to come to the hospital because of fear of contacting COVID.
Yeah.
And that's led to that some of them, they came late when they have more cardiac problem than the COVID. So the cardiac problem, I think it is still more important, and is a killing factor for a lot of patients, not as COVID.
Right. Okay.
So if they have any chest pain or if they have any symptoms, they should come to the hospital on time, not to be afraid of COVID.
Okay, and Dr. Gabala, now that you brought up that point, what we have been seeing in terms of the people who did lose their fight to COVID-19, were presenting symptoms such as those when they arrive at the hospital, shortness of breath, chest pains. Are we talking about a group of people who are also unaware of their health condition, in specific their heart?
I'm really sorry, the sound on our side is not very clear. So your question, you're talking about the patient who developed COVID?
Right.
And then I missed the last part of the question.
Right. I'm talking about some of these signs or these symptoms that are being presented in hospital when people actually show up, specifically for those who did lose their fight to COVID-19, unfortunately. Would turn up with those kind of signs, talking about shortness of breath and chest pains. So it seems a lot of us are even unaware about the condition of our hearts.
Right. Well, most of the time when we see here in the patient with COVID, about maybe up to 60%, they have some kind of cardiopulmonary symptoms. So they drop the saturation, and we get a lot of questions from other doctors that if there's something to do with the heart. In England, they have done a research for that, and they found that about 45 up to 75% of the COVID patients, they actually develop symptoms similar to acute heart attack, which means that one of the blood tests that indicate that it could be a damage to the heart muscle, it is elevated in COVID patients. This percentage, as I said, it varies a lot. Between 45, it can go up to 75 of patients that they develop what's called type 2 infarct or myocardial infarction or a heart attack secondary to COVID. When we do angiogram, we find that the coronary arteries are completely fine, and we consider that some form of inflammation of the heart muscle to COVID infection.
Okay. All right, Dr. Gabala, we'll be engaging you shortly. Please stick with us. We want to take a short commercial break and get back and continue to talk about vulnerable groups as we continue to deal with this pandemic, COVID-19. Where do you fall? Well, we'll find out in just a moment, but some of the conditions that we are highlighting today: cardiovascular disease, very common, chronic kidney disease, and diabetes, also very common. And the experts are in studio should you want to ask a question in regards to how this also puts you at a much higher risk of severe COVID-19. Well, talk to us at K24 TV is how you can reach us. Remember, our WhatsApp number is at the bottom of your screen. Should you want to call in, we'd love to hear your voice, and you may engage our experts on set. Stay with us.